Generalized Anxiety Disorder, or GAD, is more than everyday stress. While normal worries are tied to specific events and fade quickly, GAD is marked by persistent, excessive worry about many aspects of life: health, work, family, even minor issues. This anxiety is constant, often lasting for months, and feels impossible to control. The worry is out of proportion to reality, making it hard to relax or focus. People with GAD can't simply turn off their anxiety, even when they know it's irrational. It's not a character flaw, it's a medical condition involving brain chemistry, genetics, and life experiences. GAD is a disorder of the brain's threat detection system, keeping people on high alert for danger that isn't there. Recognizing GAD as a real treatable illness is the first step toward getting help. Understanding this difference empowers people to seek support and begin recovery. The core of GAD is relentless, intrusive worry. People with GAD often catastrophize, imagining worst-case scenarios for minor events. This constant mental stress makes it hard to concentrate or complete simple tasks. Irritability and feeling on edge are common, straining relationships and causing frustration. Restlessness is another hallmark. Relaxing feels impossible, even during downtime. The mind is always racing, making true calm rare. These symptoms can lead to guilt and isolation, deepening the distress. GAD traps people in a cycle of worry and mental exhaustion. It's a daily struggle to find peace of mind. GAD affects the body as much as the mind. Chronic muscle tension, headaches, and fatigue are common, as the body stays braced for threats that never come. Digestive issues and sleep problems often develop, creating a cycle of exhaustion. To cope, people may avoid situations that trigger anxiety, shrinking their world. Excessive reassurance seeking and over-preparation are also typical, as individuals try to control their worry. These behaviors offer only temporary relief and reinforce anxiety over time. The result is increased isolation and a more restricted life. GAD's physical and behavioral symptoms are exhausting and disruptive. Recognizing these patterns is key to breaking the cycle. GAD is rooted in the brain's threat response system. The amygdala acts as an alarm, scanning for danger and triggering fear. Normally, the prefrontal cortex, the brain's rational center, calms the amygdala when threats aren't real. In GAD, the amygdala is overactive, sounding alarms for everyday events. The prefrontal cortex struggles to apply logic and soothe the fear response. This imbalance keeps the body in a state of constant alert. Everyday situations can trigger intense anxiety even when there's no real danger. GAD isn't just worrying too much, it's a genuine brain circuit problem. Understanding this helps reduce stigma and guides effective treatment. The brain can change. There is hope for GAD. Treatments like cognitive behavioral therapy, CBT, help retrain the brain, strengthening the prefrontal cortex to manage anxiety. Mindfulness and meditation teach people to observe thoughts without reacting, giving the brain space to calm down. Medications such as SSRIs can reduce the amygdala's overactivity, making therapy more effective. Many benefit from a combination of therapy and medication, addressing both mind and biology. Recovery isn't about eliminating anxiety, but learning to manage it and turn down the alarm. Science is making GAD more understandable and treatable than ever. With the right support, people can restore balance and reclaim their lives. There is real hope for peace and well-being.